creating it. No doubt it is uncomfortable, I do agree, but many a times it's the words we go on emitting out creates that kind of vibration. So you need to know what are you speaking out. Very important. Do not, if it is not favorable, don't use those words. Now, disease exposure. Can you believe disease exposure? COVID. Did anybody even think of COVID? No, right? Suddenly, out of the blue in 2020, we were all exposed to this one particular problem called COVID, and it changed the whole scenario, the paradigm of health industry, just like that, upside down. And today, you can see a lot of people are becoming much more health conscious. They are looking at, they don't mind spending a little more money so that they want to become healthier. Yes, it's a good change, but at the end of the day, you need to really work on. That is where I would request all the youngsters, you all need to change your day-to-day activities. Wake up early in the morning, plan your life, plan your day. You have to do a lot of things. There is not one single day. The 24 hours is sufficient for all of us, if at all we utilize to the best of our ability. The moment you use it, definitely 24 hours time is still not sufficient. So saying that, the next thing what you can do is, you're talking about your toxic chemical. Just tell me, exposure to the pollution, can you avoid it? We cannot avoid it. We still are supposed to get exposed. Can you avoid the smoking? Yes, you can avoid. Why not? Why should you smoke? Already we are polluted with so much of pollutants outside in the air, and you still add on to the poison by smoking and then punishing your body. Can you imagine? Your 50 trillion cells will be cursing you if you're going to smoke. Already it is cursing you. Why? You are living in a polluted atmosphere. It still cannot balance. But added to that, you are going to consume alcohol, you are going to smoke. All this is going to really cause a lot of epigenetic disruption of your cell. Now, other than that, drug abuse. Can you believe? Of course, we see a lot. This is a menace where we are seeing on this planet Earth, where drugs, they know that drugs is not supposed to be a good thing, but still you see a lot of people who still are in this drug industry where they sell drugs. People become addicted to that. Now, why is that? Because that is one part of ignorant world which is there. But you and I, we are all living in a world where we still can be a little sensible in what we are doing, and we can know what not to, what to. We can do that. So drug abuse is something which we all need to avoid it if it is possible with it. Then coming to a financial state, it is going to just imagine if you're going to you want to do a hair analysis. Of course, it's going to be an expensive one. Now, unless you have the money, you will not be able to. Now, from where the money will come? This is where when you are young, from young you need to have a proper financial balancing. You need to have a proper financial, you need to have a proper way of handling your finances, day to day, monthly, yearly. You need to do that. How much of savings are you doing? All this plays a very important role, because at a particular stage of life, especially if you're 50 plus and your finances are very low, when you do not have a financial bank balance, you imagine those people. You're dependent on your children, you're dependent on the free services from the government. Now, does it look nice? Yes, of course, we still can use the government facilities, we still can use our children's, ask them for help, we can ask our friends for help. But don't you think it will be better for all of us if we have our own financial balancing and then we start working on it? Definitely it will be a better one. Then coming back to the exercise, you need to do exercise. I wouldn't know how many of you all are going for regular exercise. I see especially the youngsters. Today's youngsters are totally ignorant. But there are youngsters who are all freaks, They start, going to gym regularly. They want to overdo also. There are a lot of people who want to overdo. But you need to be balanced in your even exercise module. You cannot push your body too much, so that wherein if you're pushing your body too much, you need to balance your nutrition as well. So exercise plays a very important role. Every day you need to go for regular exercise. Other than that, your gut microbiome, that means how much of good bacteria. How do you know you have a good bacteria or not? Many people come and tell me, doc, I go to the toilet every day, no issues at all. But the moment I do the epigenetic analysis, I can see a lot of bad bacteria in their intestine, and that itself is cause of a lot of diseases. Now, saying that, how do you keep yourself? So that means how much of fiber are you taking in your day-to-day life? how much of water are you drinking. All these play a very, very important role in your epigenetic modulation. Then the therapeutic drugs. So what I mean by therapeutic drugs is if you're a diabetic, you will be on some medication. Now just imagine you're taking one tablet a day and every day for the past 10-15 days. What happens? That drug definitely has to go through your kidneys and come off, right? Now many times your kidney is not able to filter it and throw it out, so automatically it stays back and then creates a lot of problem. So this is where kidney also fails in a long run because of the medication. Not all drugs are safe. There are many drugs which has got a lot of side effects in a long run. And definitely, see, when you're 70 plus, you're a diabetic for 20-30 years, and when you're 70 plus and then suddenly doctor says you have a kidney problem, what you will say? Why doctor, I have been taking the medication regularly only, why this problem? But what the doctor can say, hey, you had a diabetes, you had a blood pressure, all these are one of the reasons why you went in for a kidney issues. Now I would say, yes, we do have a medical disease called diabetes, we do have medical disease called blood pressure, yes, it is there, but how are we going to complement in this? That is where the epigenetic comes in, that is where we are coming in. And this is where we are able to help you to become healthier. Now the moment you become healthier, what happens? Your disease process can be stopped, your disease can be controlled. I have a lot of patients where we have stopped insulin. Even the medication, whatever they are taking, is only half a tablet of it. Can be a diabetic or a blood pressure or any other tablet. So it is possible for you to become healthier, provided you handle every aspect of what you're seeing on this particular slide. It is just not what I'm telling you, advising you, and I'm doing the test and then telling you need to do everything else as well. So it is not just one particular modality of epigenetic modulation can correct your epigenetic factor. Alternative medicine, what we call it as, we can call it as herbs, we can call it as Ayurvedic, you can call it as homeopathy, it can be anything. They are also in the market for a long time, and they do treat diseases, they do make you healthy. So here, as an allopathy doctor, I still will say, if that is suiting you, you can go and take those whatever supporting alternative medication. As long as your body is healthy, you are able to maintain it, please, you should be able to move forward. And finally, social interaction. Now this is something very important. I feel sometimes a little odd in my inner gut feeling is, now just imagine these kind of platforms where we take all the measures to come down, bring this presentation for the people, to educate the people. Now don't you think it's a responsibility of the people to join us, learn and move forward? But this is where I see it's not only in this platform, in many platforms I see a lot of ignorance. Even in spite of repeated sending messages to them that please join us today, they will have 101 excuses for not coming. But this is something very important. They don't understand. It is all your priorities. Now you imagine me as a doctor. Why should I take this as a priority and then every Sunday, now Sundays I need to prepare and I need to come down, and this is a paid Zoom, so I need to pay the money for the Zoom and then finally come down here and go, and I need to tell my staff, okay, you all come and do the presentation. Why is that? It is because the passion of helping the people. Now this is where the social interaction plays a very important role. So I would request every one of you that you need to work on how do you expand this particular information to the people so that they also join us, because at the end of the day we all need to be healthy. Our aim is you need to become healthy. This is what is we all need to work on, and we all need to move forward. Now what are the causes of cell damage? I'm not going to go into very details. Something called oxidation, your mechanical stress, your physical stress, your chemicals involved in it, your nutritive, and the biological. All these are all causing a cell damage. Now you need to prevent. You need to see which is causing the problem, and then for that what you do, you need to do something, right? You need to pick up the signals of how is it. Now that is when nutrition at the cellular level plays a very important role. Now how do we know we are eating the right food? How do we know that? Many of us don't know. Now this is where this particular device called hair profiling device is available for now. It's available in India, it's available in Malaysia, where we can take 3 strands of your hair, 3 strands with the root. Very, very important is with the root, you need to take the strand, put it on the scanner, and then that picks up the signals and goes into the computer, and then from there it is sent to Germany. And within 15 minutes to 30 minutes maximum, if the internet is okay, you will get back the results in a PDF format, wherein now the doctor's role comes in. We as doctors, what we do, we would come back, we have to plan exactly what's happening. We need to correlate your problem, we need to correlate with your nutritional deficiency and your diseases as well. Now this is a very, very challenging job for a doctor. Now if it is going to be the regular practice, not what I was doing previously, I won't read and I won't do anything every day. I just go sit in the hospital. I know what the patient comes in. The moment blood pressure is high, I immediately write a medication. This is what I was doing. But today it doesn't work like that. The moment after I do the test, I will have to correlate. So I go back and then read the epigenetic factors. What is that? I correlate. I am able to correlate every situation of the disease and then tell them this is the problem you are having. And then finding a problem is the most easiest thing any human being can do. You can pick a problem, you can complain a problem, but what is the solution? This is where the experience of my 36 years of experience played a very, very important role in my today's epigenetic whatever I'm doing. It has given me a lot of beautiful support for me to move forward. Now, can you believe Cell Wellbeing Germany is the only company in the world which has this device and which has an epigenetic digital analyzer. And do you know the computer what we have in Germany is a 64 core. You and I would have heard of dual core. Now the latest one I know is octa core. That means 8 core in your computer. That is the fastest processor you have in your computer. But in our Germany lab, the computers are 64 core. So how fast it can be, how fast it can analyze, how fast it can pick up the information, you just can't imagine. Now imagine if you have to create a 64 core lab, the computer where it works 24 hours, how much of money? Almost 50 billion US dollars they would already spend in form of research, in form of maintenance. So there's a lot of things these guys are doing. Now what I do is, for me, I have the instrument, we just plug the hairs, put it on the stand, then send it across, get back the result. For you get the results, that's it. As a doctor, we do the job. Now this is something very, very beautiful, which any doctor who has the passion to read on a daily basis, number 2, need to spend at least minimum 1 to 2 hours with your clients, and then the passion to make people healthy will be the eligible doctor for them to be in epigenetic. If you are not going to do that, you can never become an epigenetic doctor, because epigenetic is not just like the regular medical practice where you just see and then you just go on writing the prescription. It doesn't happen like that. You need to work on individual patients. This is something very, very challenging, and that's the reason we cannot see more than 2 patients per day. This is my standard protocol. I cannot see more than 2 patients per day. So you know the importance what we give for you to even every client is very, very important for us. That's where we work together, and then we give the plan of treatment what we do, and then we help the people to become much more healthier. So it is epigenetic driven digital mapping. Digitally we map it. Something all new words, right? I was talking about the digitalization. Now how accurate? Many a times people will ask, how accurate? Of course, the accuracy is almost 92 to 95%, and it takes only 12 to 15 minutes, and it can pick up, how many factors? Almost 114 epigenetic markers or factors it can pick up. Now in this world, until 150 we can pick up. There are a lot of other factors as well, but at the end of the day, I would say with this itself we are able to pick up a lot of information, lot of assistance we can do for our clients. Now many times I notice that the various factors which we pick it up early through the epigenetic is your heavy metal poisoning. It can be your lead poisoning, it can be your mercury poisoning, it can be arsenic poisoning, it can be aluminum poisoning, it can be cadmium poisoning. All these are all can be picked up. Now, there is something many times which we don't understand. When you do a cellular analysis, we are talking about the cell heavy metals. But if you do a blood test, does it represent the cell? I would say no. Your blood test is on the blood level. How much is your blood levels of whatever heavy metals you're seeing? But what we would need to do is, there is something called oligoscan machine available, and that can pick up from your tissues and the cell. That is something very beautiful. So here, with heavy metals, these are all called, I would say, endocrine disruptors. Now, when you look at the kind of deficiencies, mineral deficiencies and imbalances, the metabolic rate, fast or slow, your adrenaline fatigue, your thyroid function, the nervous system imbalances, protein synthesis, inflammation, energy levels, mental health issues, liver and kidney diseases, carbohydrate intolerance, blood sugar imbalances, diabetes, insulin, all these can be picked up in your epigenetic factors. Isn't that beautiful? Instead of just checking your blood test and telling you are a diabetic, but you are a diabetic, so what? What are the other problems you have in your body? This is where the cellular analysis comes. This is where we need to go inside and see, hey, what is happening? Whereas when you look at only the blood test and then probably your 3 months of HbA1c and then your fasting sugar and then your postprandial sugar, is that the good enough? Then of course everybody will be getting your liver test done and your renal profile, your cholesterol profile, and many times you will notice that you all will have high cholesterol. Now, the moment high cholesterol, you put on cholesterol medication. Is that the solution? No. You need to get a cellular analysis, because there are a lot of issues which can be happening inside which we are not picking up. That is where we come from, the epigenetic background. We are able to pick up a lot of factors. So when you look at it, is a 36 pages of report you will get, right from the vitamins to the minerals to the toxins to the antioxidant to the electromagnetic fields, and it does include even parasites. Can you believe, if a parasite is inside your intestine, it can pick up these. The hair profiling machine can pick from your hair root that there is a worm inside your intestine. How beautifully! Now just I can't even imagine how did they even make a machine where it can go inside and then pick up from a hair root that there is a parasite sitting in your intestines. How did they do that? How did they do that? You have a vitamin C deficiency, vitamin B12 deficiency, vitamin D3 deficiency. Now what kind of research they would have done, what kind of testing they would have done. It's amazing actually. But today we have this very beautiful instrument wherein we are able to pick up a lot of information from the hair profiling, and it is going to be the future wherein we all need to work at the hair root analysis, and then only we need to go to the blood test and other things. So who can get the hair? Anybody can get a hair analysis. It doesn't matter whether you're a diseased person, no diseased person. It doesn't. You can be a healthy individual. So what? Come and check your thing. You will know where is your deficiency. From there we can start moving forward. So ultimately, as of today, you have a problem, you only tell the symptoms. Okay, I have such and such a thing. But can you just go down and see the root cause of the problem? There are many causes. It is not just one. It is not just one. So for you, the simplest way I can explain you is, when the moment you have diabetes, we only think of sugar metabolism, isn't it? The moment of sugar metabolism. But for the sugar metabolism to be not okay, you know what are the other factors? It can be your zinc deficiency, it can be your chromium deficiency, it can be a liver problem, fatty liver. It can be the kidney issue where there is an excretory problem, where it can be because of your heavy metals. It can be because of your bad bacteria inside your intestines. It can be. But the moment you are diagnosed diabetes, you are given medicines for the diabetes. But I would say there are a lot of other problems we need to look into. So that is where, when you see in this tree, the roots are something very, very important. So we go to the root cause. Now this is something called functional medicine. Now functional medicine seeks to improve the quality of life of the people. So in functional medicine, we are not bothered about what disease you have. You can have any disease, but at the end of the day, what we do is, we will assist you by checking your cellular level and then we correct your metabolic imbalances and thereby make you a healthy individual. Thereby, the end result is your disease will be reduced. The end result is you will reduce the medication. The end result is you will become healthy. Now, the moment you become healthy, don't you think it's good enough for you to move forward because your diseases will not be there? Absolutely. So what is happening is the underlying cause of most of our diseases is like a, the tip of the iceberg. We see only the tip of the iceberg. It's only the symptoms we see. The diseases, the diagnosis, what we see. But there are a lot of problems which is happening inside. This is what is all about going and checking your epigenetic factors. It's very, very important. So what the S drive can do, it's called also the super drive, the S drive. What it can do, our hair profiling machine, it can check your body nutritional status. It can catch the early progression of any illness. Where do you stand today? It can pick up. It can detect the root cause of your illnesses. It can help overcome certain chronic diseases. It can assist to optimize your body's nutrition and helps to have a better control of various diseases. You may have multiple problems, but if you do a hair analysis from there, you'll be able to rectify. Then you will be able to become better. You will be able to become healthier. So it helps to detect the cause of the chronic conditions, even skin issues. I think we have a Dr. Professor Upendra here who treats a lot of skin diseases, and then in his experience, he has a vast experience in the medical field, and then he is one person whom I have seen. He is excited the moment we talk about epigenetics, and he works from at this juncture of life. Even though he's 70 plus, he still reads, he still writes notes. As a doctor, I feel very humble when I see a doctor can be like this. So I always take a lot of messages from him, and then he is like a role model for me, wherein I pick up what he does and I practice that. Now, this is what every doctor has to do. Now, on the one side, we are doctors, but on the other side, as a client or as a patient, you can say, you need to be disciplined. You need to have the passion to become healthy. You need to have the passion to do what is right for your body. So, when you are looking at that, slowly we will be able to do a lot of things for our body, and we will be able to achieve what we want. So, what you need to do for your wellness, what you need to do, what you eat is very important. So, what you eat is what you are. So, this is and can you see here what is the photograph you are seeing? Is there any non-vegetarian they have put? No, it's all vegetables. So, it's not that vegetarians are not healthy. Vegetables can be a healthy diet for you, provided you know what to eat, what not to eat. But at the end of the day, today it's a very realistic situation where 95% of the world population are all eating non-vegetarian. Only 5 to 7% of the world population are vegetarians. So whenever I go and say I'm a vegetarian, what happens is everybody will say, how can you eat like this, how can you be? But I say I'm very healthy, I work 14 hours a day, it's not a problem. Now this is where we all need to understand that being a vegetarian is not difficult. It is easy, provided you understand that that is what your body is asking for. Saying that, we have all the certification for this particular instrument called the hair profiling machine, which we have. We have all the certification right from the FDA to the European Union certification. We all have it. So who can get assisted by doing this hair profiling? It can be chronic illnesses from diabetes to blood pressure to pediatrics to health screening to asthmatics to chronic allergies, gut diseases, autism, health. So what we are able to do is we are able to give a lot of situation for helping people in many ways. By even the health talks, what I'm talking is definitely it can help them. It can really motivate them to become much more healthier. You can do the yearly screening of your blood test, but at the same time do a hair analysis. You will be able to get in a lot of journey of positive health. So saying that the future is going to be with the S drive and the epigenetic supplementation, it's going to be our future. And then you need to be a game changer, right? I am a game changer for now for the past 9 years, because the moment I say I'm an epigenetic doctor, everybody asks me, hey, what is that epigenetic? What do you do? But they think that it is something beyond my means I'm doing. It's a very simple nutritional assessment, and then accordingly, what we do is we correct the nutritional imbalances and then make you much more healthier. So, what we request you is, do not pull your hair when you have a problem. You allow us to give 3 strands of hair, just 3 strands of hair. We will pluck it, put it on your scanner, and then we will get the information of what is happening in your health at the cellular level, and then we are there to assist you, to tell you what need to do, what need not to be done. All this guidance we are going to give you. So now, don't guess your health, check your cellular health now through your hair root analysis. We have the machine. It is available even in India. It is available in Malaysia. It's available. What you need to do, just get a hair analysis yearly once, or maybe if it is okay, yearly twice you can get it done. And then from there you start looking at. Now, of course, if you want to get a blood test, then it can be done. But as a doctor, we will tell you what are the blood tests you need to do, because 99.99% of the time you would have done your blood test and the doctor, and it will be normal. And doctors also will say everything okay, you can go back. But after 6 months, you will see you will have a problem. Now, why is that? Because you didn't do the cellular analysis. So now, I think I have come exactly 1 hour. Thank you so much for giving me this opportunity to share this knowledge on hair profiling. So my message to you would be is, you need to do your hair analysis to know your cellular health. That is the first priority, number one. Number two, correct your lifestyle with all the epigenetic modification which I told you. It's not just one thing. You need to do multiple, from multiple angles. You all need to work on, and then start working towards your journey of life. Saying that, thank you so much, and over to you, Nesa, for the closing down.
Thank you very much, Doctor. So we believe all of you all had a good session today, because the doctor has given a vast explanation, an in-depth explanation about our lifestyle and also the epigenetic. So now the next segment is over to you. To all of you all, is a Q&A session. Is there any question that you would like to raise to Dr. Prabhu? Anyone? Any questions that you would like to ask Dr. Prabhu concerning about hair profiling or any health issues?
Sir,
Yes.
sir, why heart diseases are common nowadays? And even young people are getting some support from heart disease. Why it is happening nowadays?
Okay. If I have to explain you in a very, very simplest terminologies, number one, you just imagine you have 10 rooms in your house. 10 rooms are there. Now, every room you need to supply water. Okay. Now you have put the pipes and all, everything is okay. Now every room has got taps and all. You are opening the tap initially as a child. Now I go back to the story. As a child, what happens? You open the tap, you will get the water. But over a period of time, what happens is, in the tap, in your pipes, what happens is, because of the olden days, they used to use zinc sheets pipes. So it will get eroded, and then fully it will be blocked with all the rust. So automatically the pipes get smaller, right? Now, if you are going to use a motor to pump the water through the pipes, it still can pump the water. But at the end of the day, if the block is there in the middle of the 7th room or the 8th room, what happens is that those 2 rooms cannot get a blood supply. That means the water supply will not be there. The same situation for all of us. The blood flow will not go to the peripheries. Now, if it doesn't go to the peripheries, what happens? Automatically, it will have a problem in terms of giving oxygen, in terms of giving nutrition to the peripheries. Now, this is one of the reasons we always bent upon telling you that you need to start doing exercise at a very, very early age. You need to do that. Now, if you're looking at youngsters having heart attack. Now, why do they have it? It is all the eating habits. This comes back to our regular food habits. If you're eating a lot of outside food, fatty food, all the junk food, all canned food, if you're going to eat these kind of food and the oil what you use, these play a very very important role in your arteries getting blocked. So the moment artery gets blocked, of course you will get a heart attack. Now, most of the time, what happens is you may get a stroke if it happens in the brain. Now, imagine if it happens in your kidneys. Your kidney will get a problem, but you won't know that you have a kidney attack. There is nothing called kidney attack, there is nothing called liver attack, there is nothing called lung attack. But if the circulation is impaired, automatically you will face a problem. So, if you're looking at a solution for it, it is not just one solution. You may say, doctor, I'm going for regular exercise every day morning and I go for jogging. Yes, it's good, right? But if you're not eating the right food, if you're not giving the right nutrition for your food habit, then what will happen? Automatically that nutrition deficiency will lead to inflammation. Inflammation once again lead to the vessel block. The vessel block automatically will lead to your heart attack. So it is not just one factor which is causing a problem. It is multifactorial, and you as an youngster have to start from young. What you need to do for your body is you need to look at from a 360 degrees and get all the solutions what you need to do right from the beginning. It should start as early as possible. Hope I answered you, Ashita.
Thank you, Doctor. Is there anything else, anyone like to raise any question?
We can put it in the this one also. What is that? Chat box. If some people don't want to talk, it's still okay. They can put this one on the chat box. It's still fine.
Good evening, Doctor. Nara is here.
Yes, Nara.
Okay, quite interesting on your talk. Can we know, you mentioned that we do our blood report and also this arithmetic analysis every year. So, meaning that there is going to be a significant changes, whatever things that we're gonna go through, like let's say we need to go on a supplement, we lack on certain nutrition. So the next year when we do this test, then there'll be a difference to it. So you have seen these kind of changes taking places, is it?
Absolutely, Nara. See, you don't have to go very far, Nara. You have to look at me. I am the living example for you all. Even recently, I went and got my full blood test examination. I check my epigenetic every month. In fact, sometimes monthly, 2-3 times also. Because the machine is with me, I do the checking regularly, and I see what is a deficiency available, and then what I need to do, I just correct it. But just to keep you informed, you cannot be 100% healthy. You cannot be. We all will have some deficiencies one time or the other time. What we need to do is 70 to 80% of your body, if it can be balanced with the nutrition and if it can be supported with the required nutrition, I think we all can live a very very healthy lifestyle. But what happens in a blood test is, we will not be able to see your nutritional deficiencies. Have you ever seen anybody checking your vitamin C? No. We may check your vitamin D3, we may check your vitamin B12, but how about vitamin B1? How about vitamin B2, B3, B5, B6, B9? Nobody checks that. In fact, in our hair profiling machine, last time we had B15 and B17 also. That is for cancer markers. But we were asked to remove that, and then after that the company also took it out because of certain legal issues we were looking at. So they said remove it. So in fact, looking at your nutritional deficiency, and as you said, yearly once at least, if you can do your hair analysis and your blood analysis along with it. Now what I normally will request is, do a hair root analysis, get your cellular health checking done, number one. Number two, after that, we will tell you what are the blood tests to be done, because we don't want you to go on wasting your time and doing all the blood tests which may not be necessary. We will go very specific. You get those particular tests done, and after that you need to work on your being healthy with whatever guidelines we are giving you. Of course, you can add on with whatever you know, because today with the Google there are a lot of information available, you still can get healthy through whatever the other means of support you all get from the other modalities of platform. Here we are concentrating on whatever in my 9 years experience with my 36 years of medical experience, I am able to help a lot of people in terms of becoming healthier.
Thank you, Mr. Nana, for your question. Thank you, Doctor.
Thank you, Doctor.
So is there any question?
What is our Dr. Anupama doing? I expect some Dr. Anupama to ask some questions.
Sir, good evening.
Yes, Anupama, good evening to you.
Sir, I was listening to your explanation and everything. If I have any doubts, I will contact you personally. Right now, I understood what you explained and everything. And my colleague, Dr. Nabiga, was working on hair profile. So she explained me a little about all those works she has done. So if I'm having any more doubts, I will contact you.
Absolutely. Thank you so much, Dr.
Okay. Thank you, sir.
Okay, Nessa, I think good enough.
Okay, okay. Thank you very much, all the viewers. We are in the last segment for today. And if you were to check my background, so please do not live your entire life in hospital medicine. So know your body, know yourself. There are 50 trillion cells and they work as a soldier for us. So try to activate those soldiers and have a healthy lifestyle from now onwards. It's not too late. It's all in your hands now. So Harshita, I pass the last segment over to you now. Thank you.
Thank you so much for your valuable time, and we believe all of you have benefited from the information shared by our consultant. We are here to assist you. Once again, thank you so much. Until we meet again on another interesting topic, stay tuned with us on upcoming events. Stay blessed and stay healthy. Thank you, everyone.
Thank you. Thank you, Nessa. Thank you, all the participants. It was wonderful. And for me, it's an experience. Every time I come down, I prepare myself, I come. So thank you so much for this wonderful opportunity. So see you all once again in the next episode with a new topic. And until then, have a wonderful weekend ahead of you. Thank you.
Thank you, sir.
Recording stopped.